Hello everyone, today I am going to demonstrate the sphenoid bone. In the articulated skull, you are going to find out the sphenoid bone just in front of the foramen magnum, in the middle of the cranial base. So the different parts of the sphenoid bone has been described as it is having a body, it is having two lesser wings and one greater wing, and there are pterygoid processes. So the sphenoid bone has been compared to that of the bat, where the body is the same as the body of the bat, with the two lesser wings being the ears, the outstretched wings being the same as that of the bat, and the pterygoid processes being compared to that of the legs. So we'll describe the sphenoid bone according to different parts. First, the body I'll describe, then I'll describe the greater wings, then the lesser wings, and then finally the pterygoid processes. So yes, of course, it is a lengthy bone to describe. Let us go one by one. First, before that, let us have a just broad overview over the surfaces. So altogether, without dividing it into different parts, you can find that it has got an upper surface, which is actually the surface which is facing the brain, the base of the brain. So the greater wings, they form the temporal fossa. So this is the middle cranial cavity I am describing about, and the lesser wings, they form the posterior part of the anterior cranial fossa. So you can very well guess as to what part in the articulated skull it will be. So you can try to make out where the sphenoid bone stands in the articulated skull. In the anterior part, actually it is behind the bones which are forming the anteriormost part of the articulated skull. That is why it is not visible from anterior side. You can see, of course, from the orbital fossa the anterior surfaces of the greater wing. But for the inferior surface, the pterygoid process is very much visible in the articulated skull. So you can see from the base, you can see part of it from the front, that is the orbital part, and the upper surface, of course, it is very much visible. The posterior surface also, it is not much visible because the basi-occiput, from the occipital bone, the basilar part, it is articulating from behind, so that this part, the body of the sphenoid, is actually just anterior to the foramen magnum. So I think you can make it out in the articulated skull, right? And this from the sides, the posterior border of the greater wings, this is actually articulated. It is being joined by the petrous part of the temporal bone and also the squamous part of the temporal bone here. So let us go by the different parts. Firstly, coming to the superior surface. This is the superior surface of the body of the sphenoid bone. You can see here that this part is, it seems to be that this is the articulating part with the bones in front of it, but actually it is being broken. There is a type of spine which is present in the anterior part. This is called as the ethmoidal spine, and this ethmoidal spine, it is articulating with the bone just in front of it. So what is the bone just in front of it? It is not only the frontal bone, but it is also the ethmoidal bone. Actually, immediately just in front of the body of the sphenoid, there is the formation of the ethmoid bone. There is a presence of the ethmoid bone, and that is why the ethmoidal crest is actually articulating with the anterior part, the ethmoidal spine of the sphenoid bone. Just next to it is called as the jugum sphenoidal. The jugum sphenoidal is actually, it is just below the olfactory bulbs of the base of the brain, present in the base of the brain. So when you will in your further classes, when you will see the brain, then you will see that in the base of the brain, you will see two large bulbs, the olfactory bulbs, which are just lateral to the presence of a gyrus in the base, which is called as the gyri recti. So gyrus rectus along with the olfactory bulb, they are forming the jugum sphenoidal. There is a presence of a depression just in behind the jugum, the plain area. That part is it is actually lodging the optic nerve, the crisscrossing of the optic nerve. This is called as the crisscrossing of the optic nerve is called as the chiasma, right? Optic chiasma. So this sulcus, which is lodging the optic chiasma, it is called as sulcus chiasmaticus. Behind that, whatever part of the bone which is prominent, and see from in the sulcus chiasmaticus, it is a depression, and so depression is lodging the optic chiasma. So in the front you have the jugum sphenoidal, which is a plain area. Just behind that you got the sulcus. Of course, there will be a posterior boundary of the sulcus also. So that posterior boundary of the sulcus, it is called as the tuberculum cell. So the tuberculum cell, it has got two ends on both of it, which is actually this ridge which is bounding the sulcus chiasmaticus. It is ending on both the sides, and both the sides, the elevated ends of both the sides is called as the middle glenoid process, and the posterior ends of the pointed ends of the lesser wings, this is called as the anterior glenoid process. So this middle glenoid process, it is giving the attachment to the diaphragma cellae. The diaphragma cellae is nothing but this depression which you see. This is called as the hypophyseal fossa. In this, the pituitary gland is being lodged. So this pituitary gland, when it is lodged, it cannot come out because there is a presence of a diaphragm, and this is actually made up of the meningeal layer of the dura mater. So this is having its attachment on this part, the middle glenoid process, so that it completes. And posteriorly also, behind the hypophyseal fossa, this depression, of course, I have already told, this is a hypophyseal fossa. And posterior to that, you have got another elevation. That is why this is a depression. No, anteriorly there is a elevation. This is called as the tuberculum cell. Posteriorly there is a elevation. This is called as dorsum cell. So both ends of the dorsum cell, similar to that of the tuberculum cell, has got pointed ends, just like the lesser wings having the posterior point, having at the most posterior point having prominences. This is the anterior glenoid process. The prominences on both the sides of the tuberculum cell called as the middle glenoid process, and the posterior part, the dorsum cell, which is elevation just behind the hypophyseal fossa. This has got also two prominences. This is called as the posterior glenoid process. So you have got anterior glenoid process in the lesser wing, middle glenoid process in the tuberculum cell, and in the dorsum cell you have got two pointed ends on both the sides. This is called as the posterior glenoid process. So this particular part, this whole of the arrangement together, this is it looks like that it is just like the horse seat, the saddle which is present in the back, which is given in the back of the horse. And so this whole assembly from anterior to posterior, this is called as the sella turcica. Okay, so sella turcica is nothing but, it seems like it is a seat which is placed on the back of the horse for riding purpose, no? So that is why it is called as the sella turcica or the Turkish saddle. Okay, so these are already mentioned in the book. Posterior to the dorsum cell, the slope that you find, this is called as the clavus. This is actually articulating with the basi-occiput of the occipital bone. Now if we go to the inferior surface of the body of the sphenoid, we'll see that in this part, see, this is the inferior surface. I just want to show you something, that this presence of this ridge in the inferior surface, which is here, when I show it directly on the camera from above, then it is not much visible. This part, which is the presence of, there is a ridge, this is called as the sphenoidal rostrum. So in the this sphenoidal rostrum, it is actually articulating with a diverging LA, the kind of diverging LA like this. Okay, so it is directly fitting here, and this diverging LA is that of the bone called as the vomer. I think you remember that vomer is a bone which is forming the bony part of the nasal septum. So this LA is directly articulating here, and it is forming on the posterior end. If you see, then you can see two small, actually in this part too, what I am telling, it will be wrong to say that I see that canal. The vomer, when it is articulating with this rostrum, then it is forming two uh, on the either sides of the bone. It is forming two canals. This is called as the vomerovaginal canal. So vomerovaginal canal, as such, it is not so much important because it does not transmit anything. But on the anterior ends, no, this medial pterygoid plate. So pterygoid plate has got two plates, two parts. One is the medial pterygoid plate and one is the lateral pterygoid plate. So medial pterygoid plate, this medial pterygoid plate, when it is coming here, it is forming a plate in here in this part. So I am viewing the inferior surface from the anterior aspect. So I got to see the medial pterygoid plate which is forming projection here, and this projection on the inferior surface of the medial pterygoid plate here in this part, it is called as the vaginal process. So this vaginal process, in all bones it is not so much prominent, here also it is not so much prominent. The medial pterygoid plate in the anterior part, it is articulating with the sphenoidal part of the palatine bone. Okay, so the palatine bone, when it is joining here, then it forms another groove on the anteriormost part. This is called as the palatino-vaginal canal. This palatino-vaginal canal, which is forming in the articulated, bone, sphenoid with the palatine bone, together when it is forming a canal, then it is called as the palatino-vaginal canal. And that palatino-vaginal canal, it is transmitting the pharyngeal vessels and nerves from here, both the sides, okay? Pharyngeal vessels and nerves. So this is of the inferior surface. The inferior surface, you will just see the crest, this rostrum, sorry. In the anterior part, this is called as the crest. So in the inferior surface, this is called as the rostrum. And this rostrum is articulating with the vomer. When it is articulating with the vomer, it is forming two canals, and that is not so much important because it is not passing anything, and that is called as the vomerovaginal canal. But on the lateral sides, when the medial pterygoid plates are coming from here and it is projecting medially, then this is called as the vaginal processes, and when they are articulating, the sphenoid bone is being articulated with the palatine bone from the front side, then it forms together with the vaginal processes, it forms a canal somewhere here, and that is called as the palatino-vaginal canal, and that is transmitting the pharyngeal vessels and nerves. Now let us go to the anterior surface. Anterior surface, you can see that in the anterior surface this ridge continues, and this ridge is here, it is not called as the sphenoidal rostrum, it is called as the sphenoidal crest. This sphenoidal crest, it is articulating with the posterior parts of the ethmoidal spine so as to complete the nasal septum. This on the either side of the sphenoidal crest, you can see that there is a presence of the sphenoid. This is the presence of the recess. Okay, so this is the presence of the sphenoidal concha. So this sphenoidal concha, it is the presence of the foramen. This thing you can see in the sagittal section also. In the sagittal section, this is visible as sphenoethmoidal recess. I think you remember, you have seen. If you have not seen, then you come here and then see this, that this recess, it is together with communicating with the ethmoidal concha, that means the cavity of the ethmoidal bone also, and together it is coming out in the superior meatus as the sphenoethmoidal recess. So this is that area. In this part, this anterior surface in the body, this is actually articular. So this articular surfaces, it is articulating with the, in the anteriormost part, It is articulating with the labyrinth of the ethmoid and the orbital process of the palatine bone. Let us go to the posterior surface. Posterior surface is very simple. It is just articulating with the basic occiput. The fusion usually takes place by 25 years, and if this fusion is not occurring or it is occurring before, then you will find the lateral expansion of the head more. So this is kind of abnormality. So just remember that this is a primary cartilaginous joint, which is it is articulating when it is articulating with the basic occiput, and this usually takes place and normally takes place at the age of 25 years. Now, if we have seen the superior surface of the base of the body of the sphenoid, we have seen the anterior surface of the body of the sphenoid, which is in which you mainly see the cavities, the sphenoidal foramen, and which is actually the sphenoid model. Together it is making up in the soft tissue the sphenoid model races. In the lower part, you are seeing the important thing is the rostrum, the same continuation of the crest. Downwards it forms the rostrum, which is articulating with the vomer of the nasal septum, and in the lateral side, in the anteriormost parts, this medial pterygoid plate, it is forming a projection over the inferior surface. This is called as the vaginal process. When it is articulating from the anterior sides with the palatine bone, then it is called as the palatino-vaginal canal in here. Okay, so you have seen superior surface, anterior surface, inferior surface, and posteriorly it is forming a primary cartilaginous joint. Let us go to the lateral surface of the body of the sphenoid itself. In the lateral surface, you will see nothing but a F-shaped, sulcus in both the sides. Here also, you will see a sulcus, and here also you are seeing a sulcus. This sulcus. So this sulcus is nothing but it is for the passage of internal carotid artery on both the sides. This italic F-shaped sulcus, they are saying, this is for the passage of the internal carotid artery, and on the posteriormost part here, you will find something, a projection of this italic F-shaped structure. I cannot show it. Yes, it is coming to the view now in the camera. This is called as the lincula. Okay, so in some bones it is not found, but at the most posterior part on both the lateral sides of the body of the sphenoid, you will find a sulcus. Just look at the posteriormost part. You may find a bony projection which is trying to overlap the foramen. This is called as the lincula. Okay. Now going to the greater wings. So greater wings, they are having the upper surface. This is the surface towards the brain. Okay, so this is also called the cerebral surface. On the lateral sides, you can see in the skull also, there is a presence, articulated skull also, you will be able to see the lateral surface of the greater wing. And on the inferior surface, of course, it is very much visible, the inferior surface of the greater wing. The anterior surface, it is viewed, it can be viewed in this part, especially the plane part in the anterior surface of the greater wing, that can be viewed as the most posterior part of the orbit. So this greater wing is actually more or less visible only in the articulated skull also. Let us see what we have. In the greater wing, we have presence of 3 foramen: rotundum, oval, and spinosum. So respectively, these are passing the maxillary nerve from the foramen rotundum, which can be, you can trace it down anteriorly also. See this here. I'm trying to put this probe through the foramen rotundum, and it will come out anteriorly. See, this is coming out anteriorly. As far as it is, the visibility is concerned, I know there is a problem there, because it is difficult to demonstrate as such the bone when it has got minute structures. So this is the maxillary nerve which is passing through it. Then coming to the foramen ovale, this one is the foramen rotundum, this one is the foramen ovale. You see this is the oval foramen, as the name goes, oval foramen. The oval foramen, it passes the male structures, abbreviated MALE structures. So male structures means it passes the mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, E for emissary vein. So all these structures, they are passing through the foramen ovale. Then just lateral to it, there is a small foramen which is called as the foramen spinosum. It just passes the middle meningeal artery with the nervus spinosus. Sometimes an innominate canalic foramen may be present. This is called as canaliculus innominatus. When it is present, it passes the lesser petrosal nerve. Of course, it is not present here. So let us go to the lateral surface. The lateral surface, from here I am showing. So lateral surface, if you see, then there is directly, it has been crossed. So this, there is a presence of a ridge here on the lateral surface. It is called as infratemporal ridge, and it divides the lateral surface of the greater wing of the sphenoid bone into a temporal surface and the infratemporal surface. So from the infratemporal surface, obviously the pterygoid muscle is arising. This is the upper head of the lateral pterygoid muscle, and from here the temporalis muscle is arising. Okay, there should not be any confusion as to what is arising from here. If you look at the base of the skull, then you will realize that this is actually the infratemporal fossa area, and this upper part, it is giving rise to the temporalis muscle, and the lower part, it is giving rise to the upper head of the lateral pterygoid muscle. Of course, lower head of the lateral pterygoid muscle, it is coming out from this process. What do you see here? This is the pterygoid process, right? This one is the pterygoid process, right? So which plate of the pterygoid process? Which one is present laterally? That one is called as the lateral pterygoid. The one which is present medially, it is called as the medial pterygoid. So the lateral pterygoid process, it is giving rise to the pterygoid muscle. From the infratemporal surface of the greater wing, it is giving rise to the upper head. From the lateral surface of the lateral pterygoid, it is giving rise to the lower head of the lateral pterygoid muscle. On the medial surface of the lateral pterygoid, of course, you are going to get the medial pterygoid muscle. It gives rise to medial pterygoid muscle. So pterygoid plate, especially the lateral pterygoid only, is concerned with the attachment of the muscle, not the other one. Let us look at the orbital surface of the greater wing of the sphenoid. This surface, on the cavity of the orbital cavity, if you look posteriorly, you will find a kind of V-shaped sulcus. This is the V. This is the V, okay, this one, and if you continue downwards, then you will see that trace it downwards, you will see the sulcus continuing downwards also. So it is coming from here. When I articulate this part with the anteriorly with the maxilla, then this lower inferior orbital fissure is very much visible. This is actually superior orbital fissure, and this is inferior orbital fissure. So superior orbital fissure, this is called a retort-shaped flask. See, this is a kind of retort-shaped flask. I don't know what is the, actually I have not seen in chemistry lab also, but they are saying that retort-shaped flask is something having a, somewhat called as a bulb with, tapering delivery kind of system. It is a glass equipment, just like you have your beakers and all those kind of apparatus in the chemistry lab, no? So this is a retort-shaped flask, and this is actually giving rise to the place which is called as the annulus of Zinn, no? And this together over this surface, the nerves and the vessels are coming out from the cerebral surface to supply the orbit, the eyeball, and the adjoining structures which are present here. And it is also giving rise to the 4 recti muscles. And these recti muscles take a common origin from a tendinous origin called as the annulus of Zinn, and this is present over the superior orbital fissure. So this superior orbital fissure is basically present between the lesser wing and the greater wing together, okay? And this is the orbital surface which is present, and the orbital surface is free in the upper medial part and the lower medial parts also, because it is giving rise to the superior orbital fissure and inferior orbital fissure. Superior orbital fissure, the important structure which is present here is actually annulus of Zinn, which is giving rise to the recti muscles of the eyeball, the extraocular muscles of the eyeball. Okay, so this is regarding the orbital surface. When you will go to the books, you will find many confusing statements regarding how they are describing the orbital surface, but just remember it has got the superior orbital fissure, this one, and the inferior orbital fissure, which becomes very much prominent in the articulated skull when the maxilla is joining from anteriorly from the anterior part. So you will find the inferior orbital fissure, and these are actually the free margins of the greater wing of the sphenoid, and that is why they are by using the free margin they are creating a kind of confusion. So this is nothing but there is no attachment of these parts. That is why it is visible as superior and inferior orbital fissures. Now if you go to the posteriormost part, the posterior edge of the greater wing, then we will see that in this isolated sphenoid bone there is nothing. Okay, you can see a smooth margin on the posteriormost part. Of course, I have already told you that you may find a raised ridge here, which I have said it is called as the lingula, and this is the this allows the passage of the internal carotid artery, which goes through the lateral sides of the body of the sphenoid. As I have told you, the F-shaped, italic F-shaped, structure, which is called as the canal for the internal carotid artery. Okay, so what happens is in the posteriormost part, in the articulated skull, you will feel that you will see, if you see just the articulated skull, you have to remove the confusion of finding a foramen here. This is called as the foramen lacerum. See, foramen lacerum, I have shown you one foramen, which is the foramen rotundum, foramen ovale, and foramen spinosum. These three foramen are present in the body of the greater wing, in the greater wing itself. And there is another foramen which will confuse with in the articulated skull, because in the exam you may be given the articulated skull, base of the skull also. There you may be finding one more large foramen which will be looking similar in size and in fact bigger also than the foramen ovale, and it will be just present behind the foramen ovale and a little bit medial also here in this part, this one. And this this foramen, which is called as foramen lacerum, it is formed only when the petrous part of the temporal bone, it is articulating and it is joining from here. See, the petrous part of the temporal bone, when it is coming and it is articulating here, it does not articulate in this part directly. So that is why it is smooth. There is a gap which is left behind. That gap is actually the foramen lacerum. So the petrous part of the temporal bone has got an opening for the internal carotid artery. That internal carotid artery, it emerges from the opening of the carotid canal, and then in the lacerum it takes a bend, and then it lies in the either sides of the body of the sphenoid bone in this canal. In the foramen lacerum part, the free margin on the medial end of the greater wing of the sphenoid, you will also find one more opening here. This opening, this is called as the pterygoid canal. If you put a probe here, if you put a probe here, suppose I put a probe here, then I will find that this probe, it will pass through the bone and it will emerge through the anterior end. Do you see this? See? This one. So this pterygoid canal, it is passing the pterygoid vessels and nerves. Okay, I think it is not much visible, but still you can see there is this one. This one is the probe. This is coming out. So pterygoid vessels and nerves. This, of course, it is coming from the posteriormost part. This is the free margin of the foramen lacerum, the anterior margin, anterior free margin of the foramen lacerum, there is a presence of a foramen. You have to look for yourself in the bone, and this foramen pterygoid canal, it is passing the pterygoid vessels and nerves, which is passing from the bone, the greater wing of the sphenoid itself, and it comes out anteriorly here. Okay, it is coming out. Do you see this? This one. This is the probe which is coming out. So there is a presence of a foramen here, which is presence of the pterygoid vessels and nerves. And also, if you just put the a probe from the foramen rotundum, this one is, I have shown you that this one is foramen rotundum, this one is foramen ovale, and this one is foramen spinosum. So if I put my probe through the foramen rotundum, this one will also come to the front. I will put a finer one. So this is also coming from the front. Do you see? This one, this probe. This one is coming out. So there are presence of two foramen from the anterior ends. I think you can see from here. One is for the pterygoid canal for the pterygoid vessels and nerves, this one. And this one is foramen rotundum, the anterior opening. And both of them are opening in the pterygoid fossa. I think you can very well imagine where it is. It is actually bounded posteriorly by the medial plate of the pterygoid and anteriorly by the posterior margin of the maxilla. So between that you will find the pterygoid fossa, which is just a medial continuation of the infratemporal fossa. From the pterygoid fissure, it is, you can peep in inside, and there is an important ganglion also present, which is called as the Egopalatine Ganglion. Just it is present in this part. So the maxillary nerve, it is emerging here, and this is very much intimately related to that. That ganglion is related to this part. So this is of importance. So I was describing the posterior margin of the posterior border of the greater wing, which is articulating on the lateral parts, and on the medial part it is actually the articulation with the petrous part of the temporal bone is not complete. There is a presence of, just like this, there is a presence of a foramina here, and this foramina is called foramen lacerum. In foramen lacerum, the internal carotid artery arises from the petrous part of the temporal bone through the carotid opening, and then it advances forward in this canal. There is also presence of a foramen called as a pterygoid foramen. You can see here on both the sides, here this one and here this one, through which the pterygoid vessels and nerves are passing, and they are finally emerging on the anterior part here, where the pterygoid fossa is present. And then there is also presence of, in the together when it is articulating, then there is a presence of a ridge on either sides here. In this part there is a presence of ridge. So this is actually lodging the cartilaginous part of the internal auditory or the auditory tube. So the cartilaginous part of the auditory tube is lodged in the posteriormost part of the border of the greater wing, and that is called as the sulcus tubi. Yes, one more thing which is important, which was left was, as you can see from above the greater wing of the sphenoid, you can see the sharp margin which is present in the most posterior part. Do you see this? This one is called as the spine of the sphenoid. So the spine of the sphenoid is present on the greater wing of the sphenoid, okay? And the spine of the sphenoid is important because it gives attachment to three ligaments. The ligaments are sphenomandibular ligament, which is attaching the sphenoid bone, the sphenoid to the mandible. Okay, there is a raphe of the mandible through which the which is present on the medial part of the ramus on the mandible. So that is also called as the lingula. On that part, on mandible, you can see that. So that this ligament which is coming from here, the sphenomandibular ligament, it is attaching there. There is another ligament which is called as the anterior ligament of Malleus. So you can imagine that since the petrous part of the temporal bone is present here, definitely the temporal bone itself lodges the middle and the internal ear cavity. So the content of the middle ear cavity, the three bones, the incus, malleus, and stapes. The handle of the malleus, it has got a ligament attached, and that ligament is arising from the spine of the sphenoid. And the third thing which is present, it is giving rise to the ligament. It is called as a pterygospinous ligament. Basically, it is a very short ligament. It is directly connecting this spine to the lateral plate. There is a presence of projection in the lateral pterygoid plate. So there is a pterygospinous ligament which is present and which is attaching to the spine. So these three important things, as ligaments are attached to the spine of the sphenoid. The muscles which are attached is tensor veli palatini and the tensor tympani. Tensor tympani is another muscle which is of the middle ear cavity. So tensor tympani is attached here, and tensor veli palatini, this is actually a muscle which is of the palate. So basically that muscle is arising from this fossa which is present in the pterygoid plate, between the two pterygoid plates. This is the scaphoid fossa, and from here the tensor veli palatini, the levator veli palatini is arising, and from here the tensor veli palatini is arising. So this spine, it is giving rise to the three ligaments. The ligaments are sphenomandibular ligament, the anterior ligament of the malleus, and the spectrospinous ligament. And the muscle which it is giving rise to is tensor veli palatini. This is a muscle of the palate, and the tensor tympani muscle also, which is the muscle of the middle ear cavity. Okay, let us go to the lesser wing. The lesser wing, as I have already told you, and it is attached to the body here with the help of two pillars. No, so how to look at it? Okay, let us look at it from behind. So if you see, then on both the sides, you will see that the lesser wing of the sphenoid is attached to the body. The moment it has its attachment to the body, you will see the presence of this foramen, this one. I think you can see this. This one foramen, this one. Okay, so this foramen, it is actually giving rise to the it is passing the it is also called as the optic canal, and it passes the optic nerve along with the ophthalmic artery. On both the sides I can show you. This one is optic canal, and on this side this is the presence of the optic canal. See, this is the superior orbital fissure. Don't confuse. This is present when the lesser wing of the sphenoid, it is going to attach to the body of the sphenoid. Then there, at the point of attachment, actually they are saying that it has got two pillars of attachment, and in between the two pillars, the foramen which is formed, that is called as the optic canal. And the optic canal, it is passing the optic nerve along with the ophthalmic artery. So both the sides I am showing you, there is a presence of the optic canal. And this, the sharp border which is present on the posterior part of the lesser wing of the sphenoid, this is actually giving rise to the anterior-most end of attachment of the margin, the free margin of the tentorium cerebelli. So tentorium cerebelli is nothing but it is the meningeal fold of dura mater, which is separating the cerebral part from the cerebellar part. So through this dent, of course, you can separate the cerebrum from the cerebellum, but you cannot make the whole brain totally separate. No, so there is something which is passing through it. The cerebrum, some part of it is continuing downwards, and that is basically the brainstem. So on the both sides of the brainstem, there is a formation of a tent. So that tent, the anterior-most point of attachment, when you will study the dura mater, of course, that the folds of the dura mater, this thing will be more clearer. But for the time being, I am just telling you, just remember that the tentorium cerebelli, it is the free margin, it is attaching to this part. Okay, and of course to the interglenoid ligament, there is a presence of interglenoid ligament also, and also of the carotidoglynoid canal. So this carotid and the glenoid process, middle glenoid process, they are having a ligamentous attachment. So so that the internal carotid artery is passing through it. So this is called as the carotid-glenoid canal. Okay, so these are the things which are attached to the anterior glenoid process, which is basically a backward projection from the lesser wing of the sphenoid. Okay, so also one thing I forgot to tell, which is very important, of course. If you look at the lesser wing of the sphenoid, this is the lesser wing of the sphenoid, and on the inferior surface, the lesser wing, this one, where you can see the optic canal very clearly. This is basically the orbital surface it is providing. I have told you that the orbital surface is present in the greater wing of the sphenoid. Yes, of course, it is very much prominent, but in the upper surface, the roof of the orbital cavity, the lesser wing of the sphenoid is providing some of its contribution, and from here the levator palpebrae superioris muscle is actually arising. Okay, so this is the this is all about the lesser wing. Let us go to the downwardmost part. This is the pterygoid process. I have already told you that the pterygoid process has got two plates. There is a medial pterygoid plate, which is forming a kind of projection in the medialmost part in the inferior surface of the body of sphenoid. I told you that is called as the vaginal process. Together with the palatine bone, it is called as palatino-vaginal canal. Okay, so these things you must be remembering. So this plate which is present on the medial part, this is called as the medial pterygoid plate, which has got a hook, which is called as the hook of Hamulus. Okay, and the lateral plate which is present, it is called as the lateral pterygoid plate. Together they are having two borders, but one anterior common border. In the posterior part, you can see that the pterygoid plates are having two borders. One is the posterior border of the lateral pterygoid plate, and one is the posterior border of the medial pterygoid plate. But anteriorly, they are having a common anterior border. This is the anterior margin for both the pterygoid plates. Okay, this is articulating with the palatine bone, basically the perpendicular plate. Okay, so both of them form a scaphoid fossa, which is present here. Do you see this? This is the scaphoid fossa, and I have already told you these things regarding the pterygoid plates. So this scaphoid fossa, I have already told you, it gives rise to the tensor veli palatini muscle. And in regard to the spine of the sphenoid, I was telling that the tensor veli palatini is also having its attachment, its origin from the spine of the sphenoid also. So basically, for attachment part, the lateral pterygoid muscle is important. From the lateral surface, it is giving rise to the inferior part of the lateral pterygoid muscle, and from the medial surface, it is giving rise to the medial pterygoid muscle. Please don't say that the medial pterygoid plate is giving rise to medial pterygoid muscle. It is the medial surface of the lateral pterygoid which is giving rise to the medial pterygoid muscle, and the lateral surface, it is giving the inferior head of the inferior belly of the lateral pterygoid. The superior belly is from this part. The lowermost, the infratemporal crest, which is present in the greater wing of the sphenoid, below the infratemporal crest and along with the margin, this is giving rise to the upper belly of the lateral pterygoid muscle. And this part, yes, this is the temporalis muscle. Okay, so moving again, this part which is present, the margin which is present on the anterior part, no, this is actually nothing but this forms the part of the pterygoid fissure, because when the mandible is present here in this part, so mandible does not articulate as such to the anterior margin. So anterior margin of this plate, anterior margin of that medial pterygoid plate, in fact the common margin for both the plates, this is not directly coming in contact with the maxillary bone. There is a gap, that is a pterygoid fissure through which you can peep inside the pterygoid fossa. Okay, so this is basically the things. And yes, of course, the what I forgot to tell is tensor veli palatini muscle, it hooks around this hamulus. Okay, so it is a palatal muscle, it is coming from this scaphoid fossa as well as the spine, and it hooks around the hamulus, and it finally gets inserted into the soft part of the palate. There are two parts of the palate. If you do not know, just Now you be informed that there are two parts of the pellet: the hard pellet, which is bony, and the soft pellet, which is formed by pellet and aponeurosis from the muscles which are coming from both the sides. And this is soft pellet. It is one of the muscles which is contributing to it is the tensor belly palatine muscle. Okay. There are many muscles which are found for the for forming the pellet. We shall come to know when we will discuss the pellet. So with this, I complete the sphenoid bone. Thank you.